Upon completing this in-service, you will number 1, know risk factors for insufficient fluid intake, number 2, identify the signs and symptoms of insufficient fluid intake, and number 3, list different ways to increase fluid intake among residents. As people age, their thirst mechanism becomes less sensitive. For that reason, even healthy older people may not drink enough to maintain proper hydration because they don't feel thirsty. Fluid should be offered regularly to patients in medical facilities unless they are on a fluid restriction, at meals, medication passes, before and after personal care, and during activities to maximize fluid intake. Some people, especially those who have difficulty feeding themselves or those who have cognitive problems, may have trouble drinking enough. Without enough fluid, the body can become dehydrated. Medical diagnosis or conditions that can increase risk for insufficient fluid intake: dementia or cognitive impairment, fever, diarrhea or vomiting, dependence on staff for eating and drinking, difficulty swallowing or need for thickened liquids, use of certain medications such as diuretics, antibiotics, excessive sweating, draining wounds or pressure ulcers, depression, and need for fluid restriction. Physical warning signs of insufficient fluid intake: rapid weight loss, dry or sunken eyes, dry mouth, changes in mental status, fever, vomiting, concentrated urine or decreased urine volume, dizziness, increased combativeness or confusion, functional decline. Interventions to help increase fluid intake. Fluid needs calculations are generally based on the following estimates: without renal or cardiac distress, using 30 milliliters per kilogram body weight, and remember 2.2 pounds equals 1 kilogram, or 1 milliliter per calorie consumed. If a diagnosis with renal or cardiac distress, then it would be 25 milliliters per kilogram body weight, or as determined by the physician, such as a fluid restriction. And if they're diagnosed with dehydration, their needs may go as high as 35 milliliters per kilogram body weight. When hydrated, they'll return to a 30 milliliter per kilogram body weight or 1 milliliter per calorie. Interventions to help increase fluid intake. Adequate fluid should be provided. Offer fluids frequently throughout the day, at MedPass, before and after personal care, at activities, and before bedtime. Provide early morning beverage carts. Provide midday hydration carts or evening beverage carts. Offer extra fluids or soup broth on meal trays. Offer ice chips, ice cream, fruit ices, soups, gelatins, and other foods with a high fluid content for those who do not want to consume liquids. Make sure to follow diet liquid orders. Monitor at-risk patients for physical signs of dehydration. Refer patient to speech and language pathologist if patient appears to have difficulty swallowing. Recommend adaptive equipment for eating and drinking if appropriate, may need occupational therapy referral. Report signs or symptoms of dehydration to nursing staff. Let's test your knowledge about maintaining adequate hydration. Question number 1. Which of the following does not put a resident at risk for insufficient fluid intake? A. Inability to feed oneself. B. Fever. C. Constipation. Or D. Vomiting. And the answer to question number 1. Which of the following does not put a resident at risk for insufficient fluid intake? And that would be C. Constipation. Question number 2. What are insufficient fluid intake warning signs? A. Dizziness. B. Rapid weight loss. C. Increased confusion. Or D. All of the above. And the answer to question number 2. What are insufficient fluid intake warning signs? D. All of the above. Question number 3. What can a facility do to help increase a patient's fluid intake? A. Offer fluids before personal care each shift. B. Offer more fluid at the end of the meal. C. Encourage fluids at snack time. Or D. All of the above. And the answer to question number 3. What can a facility do to help increase a patient's fluid intake? D, all of the above. Question number 4, true or false? Insufficient fluid intake can be a result of a side effect to certain medications. And the answer to question number 4 is true. Question number 5, true or false? Elderly people get thirsty often. And the answer to question number 5 is false. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service training programs or dietitian consulting services, please contact us at 800-761-9200 or nutritioncaresystems.com.